One of the many beauties that exist in this country lies not only in its breathtaking landscape, but its diversified population. Managing the healthcare needs of this population is complex and has necessitated a need to fundamentally rethink how and where healthcare is best delivered in a South African context. Delivering affordable, quality healthcare at a community level tends to be difficult, as the challenge is in keeping it cost-effective while still operating in a patient-centered, high-quality way. Affordability in delivering healthcare has become critical, as healthcare costs spiral around the world and make healthcare systems unsustainable. So how do we configure the system in order to deliver quality and affordable healthcare? Just imagine a healthcare system that not only has the potential to deliver the best of care, but is also close to people's homes. A healthcare system that not only remains affordable, but is also forever accessible to even the most remote parts of our beautiful land. And finally, a system that could relieve the often congested burden placed on centralized hospital facilities simply by providing the unique ability to go anywhere where needed, be it suburban, township, informal settlement, or rural. Innovo Mobile Healthcare specializes in delivering this flexible healthcare system. Innovo is able to deliver services that have been limited to district and central hospitals, while simultaneously making these referral hospitals less congested. The innovation lies in Innovo's ability to provide clinical services on demand, deliver various types of care and interventions for varying conditions. The burden of disease, made up of communicable diseases such as HIV and TB, chronic diseases related to unhealthy lifestyles such as hypertension and diabetes, as well as high maternal and child mortality, creates a high demand for clinical services. This requires interventions in services such as endoscopy, ophthalmology, orthopedics, general surgery, and urology, amongst others. In its current form, the healthcare system is overburdened, overloaded, and unsustainable if primary healthcare is not strengthened and augmented in innovative ways using technology. It is critical for the future that sustainable and adaptable ways of reducing the pressure on centralized facilities are implemented and found. Imagine if we could take just 10% of screening, diagnostics such as pathology and radiology, as well as office or day surgical interventions out of the traditional acute hospital setting. Then we could significantly improve primary and secondary care at a community level and positively impact on patient flow, quality of care, and the overall quality of the patient experience. Clinical services can be configured according to patient needs, thereby increasing the reach of primary and district health services. Furthermore, changing demographics and urbanization make fixed facilities less economically viable solutions. And most importantly, using flexible and adaptable solutions could save up to almost 25% on the cost of primary healthcare delivery. The alternative solutions that Innovo provides are affordable, quick to deploy, and tried and tested. They each provide additional capacity to existing facilities, provide capacity when geo-immigration patterns change, and extend capacity where none was previously planned for, such as in our informal settlements. These solutions re-anchor screening, diagnostic, and treatment services back in the community setting and include transforming local community clinics into community health centers by adding mobile radiology diagnostics facilities, which may include X-rays, ultrasounds, and in some cases, CAT scans. Transform primary healthcare facilities into both screening and treatment facilities by attaching mobile dental and eye clinics when needed, enabling early diagnosis of high cost to treat conditions through the use of cervical cancer screening units, mammography for breast cancer, and prostate cancer screening units. Enable community-based elective surgical interventions by adding multi-bay operating theaters to deliver procedures such as medical circumcision safely and in the community. And lastly, by providing diagnostic services that medical officers can be trained to deliver, such as mobile endoscopy or cataract removal facilities. Innovo can provide all these services across a wide geography, thus maximizing their use and ensuring that all services are cost-effective, relieve pressure on existing facilities, provides timely and speedy access to treatment, delivers care in a community setting close to the patient's home, and provides high-quality care that is affordable, sustainable, and most importantly, always available. For the first time, due to mobile, we can improve primary health care whilst delivering some secondary care services at the community level and impacting patient flow, quality of care, and the quality of the patient experience. Innovo is already experienced in delivering these mobile services through logistics and maintenance, staffing and training, clinical governance, community communication and awareness, and lastly, quality assurance. Innovo Mobile Healthcare, bringing you best of care close to home.